ओम दम धन्वंतरे नमः। रागादिरोगान् सततान् शक्तान् अशेषकायान् प्रसतान् शेषान् औत्सुक्यमोहान् रतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै। So today's topic is hypothyroidism, its Ayurveda management. There is a thyroid gland in the neck region, and it is endocrine gland, endocrine gland, and it secretes T3, T4, and thyrocalcitonin. So when the functions of thyroxine is reduced because of thyroid secretion deficiency, there will be symptoms of hypothyroidism. And Ayurveda system of medicine has a better role in the management of hypothyroidism. So incidence of endocrine disorders are increasing in India as well as in whole world population. Diabetes, hypothyroidism, hyperthyroidism, hyperparathyroidism, Cushing's syndrome, gigantism, dwarfism, and Conn syndrome are increasing in the society. Symptoms like obesity, constipation, hypercholesteremia, slow mentation, and bradycardia are common in hypothyroidism patients. These are the common symptoms. Medicines like Medhavara Navagulu, Amritadiyogulu, Lashana Shirapaka, Lashana capsules, etc. are useful in hypothyroidism. These formulations usually have actions like hypocholesteremic, thyroid stimulant, reducing body weight, the discussion action, laxative and positive chronotropic actions. The present paper highlights about the Ayurveda management of hypothyroidism patients. So histology of when we see the microscopic anatomy of the thyroid gland, the cut section shows like this, isn't it? There are thyroid follicles. Thyroid follicles are lined by follicular cells. They are cuboidal cells, epithelial cells, which surround colloid. Centrally, there is colloid. The pink staining in the center, it is the colloid. And colloid will be combining with the thyroxine T3 and T4, thyrobulin, thyroglobulin, etc. And it is stored, isn't it? So this is also thyroid gland. You can see thyroid follicles lined by follicular cells. There are in between some other cells also there. Isn't it? They are calcitonin, secreting calcitonin. So in the center, there is colloid. Now let us see signs and symptoms of hypothyroidism. Obesity, somnolence, that means in the drowsiness, isn't it? In the daytime also. Bradycardia, slow mentation, constipation, amenorrhea in females, anemia, impotency, hypotension, hypocholesteremia. These are all the symptoms of hypothyroidism. Now the test, thyroid function tests, include estimation of T3, T4. T3 means triiodothyronine. T4 means thyroxine or tetraiodothyronine. TSH, that is secreted from the pituitary, and serum total cholesterol and lipid profile. Now let us see the Ekamalika Prayagas in hypothyroidism. They are Guggulu, Haritaki, Vibhitaki, Amalaki, Panchakola, Lashuna. Isn't it? This is Shinti, gingival officinalis. It is CNS stimulant action. It will correct somnolence and slow mentation. Isn't it? This is Guggulu, Commiphora mucul. The gum is used, resin is used, and it is stimulating the thyroid gland by increasing the secretion of T3T4 and increase the thyroxine activity. This is the gum Guggulu, which is purified and processed and used in the treatment. This is the Shilajatu. In Sushruta Samhita, Shilajatu is told best remedy for obesity. In hypothyroidism also, there is obesity and hypercholesteremia. Shilajatu is a better preference. Triphala, it has a Virechana action. 3 Mayra balance, like Haritaki, Vibhitaki, and Amalaki, which have purgative, this laxative action and also useful in hypothyroidism. The Punarnama, Borhevia diffusa, which is a diuretic drug, Mutala drug, which has action on hypothyroidism. And let us see the histology of adipose tissue. There are adipocytes with the fibers, isn't it? Adipocytes are having eccentric nucleus in the periphery, and the whole is occupied with a fat globule, isn't it? So hypothyroidism, fat is increased, fat adipose tissue is increased, isn't it? This is a cerebrum histology, isn't it? Various layers are there. Cerebrum, the CNS, part of the CNS, in hypothyroidism, it is affected, and there will be slow mentation, somnolence, drowsiness, etc. will be there. CNS stimulants are to be given. Other single drugs are Maricha, Amlavetasa. Amlavetasa is reducing body weight. Lobasma, Mandorabasma, Chitraka, that is Plumbezogelenica, Bellataka, Semicarpus, Anacardium, and Kalamega. These are all the single drugs. Now let us see the formulations which are useful in case of hypothyroidism patients. Turishanadiloha, Amrtadi Gugulu, Navaka Gugulu, Medohara Gugulu, Punanamadi Mandora, Trifala tablets, Amlavetasa Palachurna, Lashana Shirapaka, Panchakola Kashaya, Panchayikta Kashaya, Gugulu Kalpas, Kanchana Gugulu, Trifala Kashaya, Shotari Mandora, Lavangadi, Vidangadi Loha, Loha Basma, Mandora Basma, Trifala Mandora, Lashana Loha Rasayana, Shurakshara Kasisa, Trifala Churna, Chitragajvati, and Ballatakoti. The Chitragajvati and Ballatakoti, they will increase the BMR, basal metabolic rate, and have a thyroid stimulating action. Now let us see for planning the treatment of hypothyroidism, we have to treat according to the symptoms. We can also treat, isn't it? We can also treat by increasing the thyroid activity, and simultaneously we can also treat by treating the individual symptoms like obesity. In obesity, Turishanadiloha, Rukshodvartana, Vyayama, daily walking is used. In somnolence, tea, coffee, they are CNS stimulants. Pugachurna is also CNS stimulant, Rekaketachu, and Shintikashaya is also CNS stimulant action. Okay. Bradycardia, for bradycardia, we can use Kanakasa, which contains atropine, is anticholinergic drug, which increases the heart rate. Coffee and tea also stimulants. Slow mentation is there, then we can use Shintikashaya, Chikadchurna with Madhu, and tea. They are CNS stimulants, isn't it? Constipation usually seen in hypothyroidism patients. We can use Trifala tablet, Trirutleha, Vaipatikar Churna, Kotiki Kwata, and Shatsakar Churna. They are all laxatives, isn't it? So for amenorrhea, which is seen in hypothyroidism patients, we can use Yogara Yogulu, Rajapravutinivati, Ashokarishta, and Ulat Kambal Kashaya. For anemia, we can use Nava Saloha, Datri Loha, and Soha. Anemia also seen in hypothyroidism patients. In impotency, we can use Siddhamakaraja, Vanari Kalpa, Kaunchadivati, and Madana Kameshwari Leha. In hypotension in hypothyroidism, we can use Lagusada Chakravarti, Makarajavati, and fluids, plenty of fluids. In hypercholesteremic drugs are given. For example, Navagugulu, Lashana capsules, and Amrtadi Gugulu. Now coming to discussion. Hypothyroidism is caused due to loss of activity of thyroxine, less activity of thyroxine in the body. Thyroid hormone is secreted when pituitary gland is secreted more TSH, thyroid stimulating hormone, which in turn stimulates the thyroid gland for further secretion of thyroxine. Thyroxine is mainly responsible for increase in BMR in the body. The symptoms of hypothyroidism can be better treated symptomatically by Ayurveda medicine for alleviation of signs and symptoms like obesity, bradycardia, somnolence, slow mentation, constipation, amenorrhea, anemia, etc. CNS stimulants, hypocholestemic, laxative drugs are positive, and drugs having positive chronotropic action, hypertensives, and Kashana drugs can be used in the treatment of hypothyroidism. Drugs like Gugulu, Lashana, Amlavetasa are effective in the disease management. Rukshodvartana, Vyayama, and daily walking are effective in these patients. They correct the body weight also and decrease the cholesterol also, serum cholesterol also. Coming to conclusion, hypothyroidism is caused due to less activity of thyroxine, T3 and T4, isn't it? T3 triiodothyronine and T4 tetraiodothyronine or thyroxine. Ayurvedic drugs and formulations are effective in the management of hypothyroidism patients. There are least adverse reactions during Ayurveda treatment if it is given in correct dosage, isn't it? And patyas are, we can use pulses, isn't it? Green leaf vegetables, high fiber containing food stuffs, this we can use. And avoid curried and fried things, fatty or the food items containing fat, excessive fat, that also should be avoided, isn't it? So these are the conclusions. So these are the references. So thank you for patient hearing.